Well, of course I could. Lyme disease is a rare disorder which occurs whenever you eat so much of the fruit of Citrus aurantifolia that you start misspelling the names of other illnesses such as Lyme disease. Lyme, damn it, with a Y. Coming from Old Lyme, Connecticut, where the disease was first described in the 70s as a separate entity. The disease itself had been around for much longer, we're talking centuries, but its various symptoms were and still are rather inconsistent in their appearance, and the causative agent is so hard to detect that we just couldn't put the puzzle pieces together before. I mean, can you blame a doctor in the 19th century for not figuring out that Mrs. Egbert's facial palsy has the same origin as Mr. O'Neill's knee pains and the rash on little Tommy's tummy? We're talking about a world where drowned victims are resuscitated by blowing tobacco smoke up their butts. Without much success. We know now that Lyme disease is caused by bacteria of the Borrelia genus, so it's more elegant to call the illness Lyme borreliosis. The species Borrelia burgdorferi, or as his drinking buddies call it, BB, had been the only known culprit behind the disease for long years in the past. However, as time went by, other guilty Borrelia species have been discovered too. We refer to them collectively as, well, also Borrelia burgdorferi, but in the broad sense. Nothing else was available during the great bacterium name shortage of the 80s. BB is prevalent in the northern hemisphere under moderate climate, and the only natural way of getting infected is by the bites of infected ticks. So not by petting infected dogs or infected people, not even if they bite you. And ticks, of course, get infected through biting infected hosts, with rodents being the main sources. Many vertebrate species can contract the bacteria this way, but only few are known to actually show symptoms. Humans, dogs, horses, and several animal species used in laboratories are among those, but cute cats, for example, aren't. We all heard stories of how miserable people with Lyme disease can have it, so how bad could it really be? Should you still bother to open a retirement savings account if you get infected? The good news is, a small minority of infected folks never develop symptoms for some reason. If you, however, belong to the vast majority, you will experience some of the clinical signs of Lyme disease, ranging from mildly inconvenient to skydiving naked strapped to a bear inconvenient. Symptoms in humans are staged by disease progression as whoa, let's not get carried away. A basic tombstone will do just fine. So symptoms are staged as early localized, early disseminated, and late disseminated. Early localized means the bacteria have not had time yet to spread in the body, they are only present near the tick bite location. This may result in a slowly growing rash on the skin called erythema migrans, or EM for short. As it grows, its center may clear up and get red again, giving it a characteristic bullseye appearance. Avoid archery ranges at this point. Although the bacteria are localized, general mild flu-like symptoms can accompany the rash. Symptoms of this stage appear days to a few weeks after the tick bite, or don't appear at all. Early and late disseminated stages share a lot of similarities, so we'll lump them together for simplicity. The bacteria leave the infection site and give you grief elsewhere in your body, weeks, months, or even years after initial infection. The most common problem is arthritis affecting various joints, mainly large ones like knees and elbows. It comes and goes periodically, causing swelling and pain. Neurological involvement is less common, especially in its severe forms, but it does happen. When individual nerves are affected, pain and/or paralysis in the corresponding areas are the leading symptoms. You've probably met people before with those strange half-alive, half-undead faces you should never be making fun of because it's not funny. That's called facial paralysis or palsy, and Lyme disease is one thing among several that can cause it. And if your brain is affected, all bets are off. Fever, confusion, memory loss, vomiting, seizures, a typical Friday night. Borreliosis can also meddle with your heart and mess up the rhythm of your heartbeat, or in some cases give you a full-blown inflammation of your heart. As for the skin, EM may appear in several places on your body, and in about 1% of cases, borrelial lymphocytoma develops, which is a swollen reddish-blue nodule usually on the earlobes, nipples and scrotum, the latter being an extremely rare location in women. Acrodermatitis chronica atropicans is a fancy Latin term for the chronic inflammation of the skin on your hands and feet, which turns your skin paper-thin and vulnerable. At this point, you may rightfully ask, is this all? Can't you even get blind from it? Ocular forms of Lyme disease manifest in the inflammation of various parts of the eyeball and surrounding tissues. Blindness can occur. And there's a mystical, controversial phenomenon tied to Lyme disease called post-treatment Lyme disease syndrome, which is a collection of vague general symptoms appearing sometimes years after treating Lyme borreliosis. Emphasis is on after treatment, so it shouldn't really be Lyme disease because that's been dealt with, but what is it then? And how? And why? Well, that's uncertain at this point. Some say it's an odd immune reaction that remains active in spite of the pathogen having been eradicated. Some say that perhaps a small fraction of Borrelia may be able to survive Lyme disease treatment after all and linger around causing mischief, while others say it's just a bunch of hypochondriacs making shit up. People tend to go to war over this, figuratively speaking of course, so let me just say I don't know what the deal is, but we have top people working on it. Dogs appear to be more resilient to BB than humans, with only 50–60% of infected animals actually developing symptoms according to experimental studies. In practice, however, this number seems to be even smaller. Much smaller. Probably because symptoms are often mild and overlooked, or go away before you'd notice them. Like, can you tell what's wrong with Priscilla? Apart from the obviously neglected oral hygiene. Probably not. The early signs are generally absent. EM, for one, has not even been reliably documented to occur at all in dogs. Dog Lyme comes in only two forms really, as intermittent arthritis like in the case of humans, and rarely as a kidney disease not seen in people called Lyme nephropathy, which is usually fatal. To be frank, we're not sure the latter is really a Lyme thing, as it hasn't been experimentally reproduced so far. The mechanism by which BB infection would damage the kidneys is not fully understood, but we suspect the damage isn't directly caused by the bacteria, rather by a misguided immune response. The existence of cardiac forms of Lyme disease in dogs is not supported by strong evidence. Some experts say it's real, others are not convinced. There's even less to suggest the existence of neurological forms. Even if they exist, BB couldn't be established as the cause so far. Okay, so Lyme disease sucks, but given its insanely diverse appearance, how do you know you have it? How can your doctor tell if your knee pain is caused by borreliosis and not by excessive Irish folk dancing, or by the crazy lady next door cursing you for calling her cat furry Jabba? In some instances, it's simple. If there's a characteristic EM rash, you missed, plus a known history of tick exposure, you can safely bet it's Lyme. This is true for more than half of human cases. The rest, where EM is lacking, which by the way is like 100% of dog cases, is a bit tougher nut to crack. Diagnosis is far from self-evident here, and several factors have to be weighed against one another because A. Borreliosis is not the only illness Lyme symptoms are characteristic of. B. Symptoms may take a long time to appear after initial tick exposure, so a causal connection is far from bloody obvious at the first glance. And C. Diagnostic testing for Lyme disease is much like modern art. Interpreting it is tricky. A Lyme test result might look like one thing to the uninitiated.
It's a shoe.
But something wholly different to someone familiar with Lyme.
Clearly, it's the suffering of Genghis Khan's butt cheeks.
This usually makes those who want answers right now, or preferably yesterday, angry. So how do medical professionals come to a conclusion? They consider the probability of tick exposure, even if the patient can't report on a tick bite because they don't remember or because they're just a dumb chihuahua that can't talk. They consider and investigate other illnesses with similar symptoms. They perform diagnostic tests and maybe feel even more confused afterwards. And if they are still none the wiser, they can always attempt treatment with antibiotics. Not like this will provide much info, but hey, it might just work and a happy patient is what you're after. No, you don't do that! Jesus! What happened to the responsible use of antibiotics? Go back to step 3. Ask a Lyme nerd if you have to.
Not happening. She played patty cake with my husband.
Fine. Antibiotics it is then. But you got to be at least 91.56 plus pi% sure it's Lyme disease.
Pie.
Time is up, but there's way more to Lyme disease, so we'll continue the discussion in the next episode. The technical information in this video was fact-checked by Kathryn Reif, expert in all things tick. I thank her very much as I thank Ceva for its support. If you've made it this far, why not like, comment or subscribe, or check out my other videos. I know it would make at least one of us happy.